In recent years, new medications have appeared on the market for the management of obesity. And these medications are GLP-1 analogs, which mimic the effects of a molecule secreted by our intestines called GLP-1, which stands for glucagon-like peptide 1. This molecule is naturally secreted by this organ during digestion, and it has many effects that help our body regulate the digestive process and our metabolism. Notably, one of its major effects is on blood sugar levels and insulin metabolism. And that's why initially this medication was given to patients with type 2 diabetes, particularly in the form of Ozempic, to help regulate their blood sugar. However, during studies and as the medication was used, it was noticed that people taking GLP-1 agonists tended to lose weight over time. And in fact, this was linked to another mechanism of action of this molecule, which acts on our brain, more specifically on the hunger centers, because indeed this molecule tends to reduce our sensation of hunger and has what we call a satiating effect. And so, at that point, quite a few laboratories became interested in how this molecule could be used to induce weight loss. And today we know that this molecule has an effect similar to bariatric surgery in terms of weight loss, and we can see weight reductions of 15 to 20% of body weight 1 year or even 2 years after starting treatment, which notably helps to limit one of the main effects of obesity, namely an excess of body fat. The problem is that since this molecule increases satiety, there will be a decrease in food intake, especially of proteins. As a result, in this weight loss, when we look more closely at body composition, there will also be a decrease in muscle mass, which can be quite significant. This may limit the patient in their daily activities and thus lead to increased frailty. And at that point, bioimpedance analysis becomes extremely valuable during patient management. Indeed, it allows us to check both that fat mass is being lost and that not too much muscle mass is being lost. And so, if we find ourselves in a situation where muscle mass is starting to be lost, this will allow us to adjust the management approach, perhaps by increasing the amount of protein consumed, but also by increasing the amount of physical activity performed by the patients.